Hi, everybody. It's Monica. Thank you so much for your patience and bearing with us. Day one of our virtual conference, our first time ever. As you can imagine, we have been troubleshooting today. I think folks, everyone's good with audio and their visual. We will have our CPEN staff using the slides, Dr. Kushal and Sheena, that you sent over to us. And as we discussed for the run of show, Liam, if you can open, and then everyone will introduce themselves, and then we'll segue into your questions, Liam.
Sounds good. So hi, everybody. My name is Liam Dillon. I'm a reporter with the Los Angeles Times. Excited to be here for this very interesting panel on the social determinants of health and housing environment. And sort of we're going to talk today about how housing and environmental impact and the environment impact one's ability to live a healthy life, talk about how the pandemic has exacerbated housing and environmental justice issues, address some of the policies that have led us here, and then talk about some of the changes we can make moving forward. And now I'm going to let each of our four fine panelists introduce themselves. And why don't we start with Trina Robinson.
Sorry, Liam, sorry. We need to admit all of our participants. Sorry, this was the green room. We were just among speakers. And I will admit everybody in just one moment. Apologies about the confusion. I should have been more clear.
Okay.
That was a great
But that was great, Liam, and you should just do that again once we admit everybody.
Okay.
Okay, there we go. Thank you everyone for joining. We see the participant number is going up on our end. So I will hand it off to Liam Dillon, staff writer with the LA Times, to get us started. Thank you for joining.
Good morning, everybody. My name is Liam Dillon. I'm a reporter with the Los Angeles Times. I cover housing affordability issues statewide, and I am excited to be here to help moderate what I'm sure is going to be a very good conversation on the social determinants of health and housing environment and health. And we're going to be talking about a few things over the next hour or so, addressing how housing and environment impact one's ability to live a healthy life, talking about how the pandemic has exacerbated some housing and environmental justice issues that were already troubling in the state, talk about some of the policies that have led us here, and then finally think about some of the changes we can make moving forward to better the situation. So we're going to have about a little bit of an opening with some of our panelists providing some slides to kind of frame our discussion. But before we do that, I'd just like each of the panelists, our four panelists, to introduce themselves, and we'll start with Trina Robinson.
Great. Good morning, everyone. My name is Trina Robinson. I'm policy coordinator with the Asian Pacific Environmental Network. And I'll just take a couple minutes to introduce APEN, the organization, and our history. And if it's possible to go to the next slide, I just have a couple images to do that. Yeah, so just for folks who are coming from outside of kind of environmental justice perspective, the EJ movement was born out of the civil rights movement and understanding that those left out of decision-making and political processes are the most harmed. And through organizing, we can build power in authentic and deeply rooted ways. So APEN was born out of that, of the first National People of Color Summit on Environmental Justice to serve Asian American immigrant and refugee communities. So APEN works in 5 Asian languages and has bases in Oakland, Richmond, and also works statewide through policy advocacy and creation, and statewide voter mobilization. Yeah, I think I'll leave it at that. There were a couple others, but I know we're running a little bit behind, so I'm sure I'll get to it in the deeper conversation.
Okay, let's go next to Ashley Warner.
Hi, everyone. I don't have a slide, but I'm Ashley Warner. I'm a directing attorney with Leadership Council for Justice and Accountability. We are based in Fresno. We're founded in 2013, so about coming up on 8 years old now. We work throughout the San Joaquin Valley, from Merced County down to Kern, as well as the East Coachella Valley. And our mission is to work alongside residents of the most impacted communities to eradicate injustice and secure access to opportunity regardless of wealth, race, income, or place. So in these regions, we work in about 30 communities on the ground. There are low-income communities of color. Many of them are farm worker communities that lack access to a lot of like basic investment, public and private, and access to opportunity. And so our work really focuses on ensuring access to decision-making and determination of how resources are invested, and critical decision-making that impacts people's quality of life. And so we deal with things like access to water and sewer service, safe and affordable drinking water, access to transportation, housing, and fair housing choice, and residents' ability to be at the decision-making table from the local to the regional to the state level. And some of the tools we use are organizing is very central to all of the work that we do, striving to ensure that residents are really driving our work and our agenda at all stages. And then we use policy advocacy from the local to the state level, as well as legal advocacy and selective impact litigation. So I will hand it over to the next panelist.
And why don't we go with Dr. Jennifer Martinez.
Hi, good afternoon, everybody. Glad to be here, or maybe it's still morning. Glad to be on this esteemed panel. I'm Jennifer Martinez with PICO, California, a faith-based multiracial community organizing network across California. We work with low-income communities of color through faith institutions. We work in 17 counties across the state with the aim of transforming California for racial and economic justice. Our primary modes of engagement are to advocate at the local and state policy levels, as well as we do a lot of electoral work and other sorts of direct action campaigns. And I'm coming to this conversation primarily through the lens of housing, tenant rights, housing affordability, and the history of racial segregation in our country.
And our last panelist for this morning, Dr. Margot Kushel.
Hi, and I think I'm going to skip my slides. I'm Margot Kushel. I am a physician and a professor of medicine at UCSF, where I direct the new Benioff Homelessness and Housing Initiative. And we are a research and policy center within UCSF that is focused on both understanding and changing the drivers of health via housing. We like to say we're working on the 3 Ps, on influencing policies, programs, and perspectives. And we use a lens called strategic science, where we work with our communities, whether those are impacted communities, whether it's nonprofits, housers, or governmental bodies, to listen and hear what are issues that they may be getting stuck on that they feel like data could help inform them or research could help inform them. And we try to do that research quickly and turn it around to try to advance evidence-based policies and practices to prevent and end homelessness and to work on issues of housing instability, particularly as it impacts health.
Great, so everyone is good with slides. No one has any other presentation. I just want to know that before we move forward. Okay, here's that way. All right, so what we're gonna do, we're gonna have a moderated conversation, and hopefully it'll be more of a conversation than me just asking questions and people answering. So everyone, please feel free to cut in if you see something or hear something interesting that you wanna raise. That will be going on until about 12:15, and then we'll have time. Please make sure If this is for the audience, if you have questions, to drop them in the chat box, and we can get them to our panelists at the end as well. So I want to start with something that is, I think we'll do a good job of helping to frame the conversation. This is for everyone, and I'm wondering if each of you can provide a concrete example from your work about how someone's housing situation affects their overall health, and maybe pick an example that might not be super obvious on first glance. And anyone who wants to jump in with this, please be my guest.
I guess I'll jump in. You know, we like to say that housing is the best medicine, and as a physician, I can tell you that there's very little that I have in my toolbox as a physician that outweighs the influence of housing on people's health, which is why I actually spend more time working on housing these days than I do on health. I think it is a prime driver. I think there's some obvious ways, and I think the COVID pandemic has really unleashed the obvious ways that housing impacts health. I think people often make the connection between homelessness and health, but it sometimes has been harder to drive home the impacts of housing overcrowding or housing cost burden on health. And I think the COVID pandemic, you know, clearly made clear the devastating impacts of homelessness all across North America. We saw these massive outbreaks of COVID in homeless shelters, so that was pretty obvious. But really, as we've seen since the beginning of the pandemic, the story of COVID is really the story of essential workers living in overcrowded, multi-generational households. And this is something that those of us who are sort of housing and health geeks have known for a long time, that it doesn't take just being homeless until your housing really impacts your health. I think COVID has made it really clear. You know, overcrowded housing or housing cost burdens where people spend more than 50% of their income on rent. First of all, that displaces a lot of other health-related behaviors. People can't buy healthy foods, people can't get healthcare, people can't educate. But it also has all sorts of stresses and strains we've seen with infectious diseases. We see with mental health, things like sleep, blood pressure, all of these things have been shown to be impacted. So I really think of housing, it's not this dichotomy of like you're homeless or you're housed, but it's really on a spectrum. And as you can imagine, this plays out very much along the sort of cleave lines of racism in our society. And it's, you know, and so I think it is one of, not the only, but it's an important driver of racial disparities in health outcomes as well.
Yeah, I can jump in. Thinking particularly about some of the communities that APEN works with as well, that are immigrant or refugee kind of enclave communities, and how those were formed. And those were formed because of policies that promoted racial segregation and you know, put people of color, put immigrants, refugees near heavy industry, sites of pollution. And despite that, you know, these communities being on the front lines of fighting to clean that up and change the rules so that nobody has to you know, be breathing contaminated air, dealing with contaminated soil and water. And so when we think about environmental justice and climate justice, there's a lot of lessons from that expertise in terms of understanding the risks and the history of their homes and fighting to change it, as well as a lot of really, you know, resilient and resourceful behavior. And then when we think about displacement and those affect the displacement pressures and gentrification pressures. And, you know, after that legacy, there's also this factor of, yes, the neighborhoods still need help in terms of cleaning up and becoming more healthy. But at the same time, there's a strong social cohesion, there's access to social services in language. You know, there are community facilities that help people feel you know, safe or welcomed. And those are also really part of having a healthy community. That's, yeah, one of APEN's original campaigns was helping some monolingual seniors stay in their housing, because we know that when displacement happens, also that kind of dilutes our political power and our ability to fight collectively for things that make our neighborhoods or our workplaces healthy. And at the same time, we still have to keep fighting for better decision making, because even with those collective fights in terms of fighting for open space, clean air, there are still things that are up to the landlord discretion, or things that can be really harmful inside the home. And so it takes like a multi-layered fight when thinking about environmental justice and climate justice in housing.
I can go next. So when Liam asked this question, what came to mind for me was a particular resident that we work with named Katie, a really incredible person. And I keep telling her I wish she would run for mayor of Fresno. She lives right outside of city lines in unincorporated county. And she's been living in her home for decades, and it really is home for her. And she cares for her adult daughter who's disabled there. Doesn't feel like it's a place that she could move from or would want to move from, because it's really a source of stability. But it's also the most polluted census tract in California under CalEnviroscreen, a tool that the California EPA created to measure vulnerability to health impacts in communities. Multiple people in her household have died from cancer, as well as at least one person in all of her neighbors' homes. She is just outside of Fresno city limits and is on well water, which has gone dry in the last few years. And she had to rely on emergency connection to her neighbors. So that's obviously a big health risk and a health impact. She couldn't flush her toilet for days, couldn't get access to tap water in her house. And at the same time, when she does have water, there's a really big concern about what's in it. Nearby her house, there's a couple of different sites that are listed on the Department of Toxic Substance Control's registry for having toxins in the soil. And there has been Chrome-6 and other contaminants found in the water. So this is water that she and other residents are interacting with through their tap, through the shower, drinking at times. And then kind of to add on to all of this, the city of Fresno has been planning this area to be a 6,000 acre industrial business park. And so her home is pre-planned to become an industrial center. So when you look at the map for the city of Fresno's projected growth trajectory in the next 15 to 20 years, and you look at where her house is, it's colored gray because that color means industry. So they're anticipating that somehow that parcel will be acquired and converted into a warehouse or some other job creator in their view. And so over the last few years, she has seen an 885,000 square foot Amazon warehouse go up across the street from her, an Ulta Beauty distribution center next to that, as well as a host of other warehouses. And so the area went from an agricultural area to a warehouse business park, and it continues to go in that direction. And so she now has thousands of truck and car trips going in front of her home every day. And I think later in the panel, hopefully there'll be a chance to talk about the health impacts of that. But as you can imagine, being in a small house built in the 1940s, right next to a road that has trucks rumbling by, heavy duty trucks, there's a lot of like vibration, sound, light, all sorts of impacts, aesthetic impacts that really affect quality of life and health in so many ways. So for Katie, housing is both like a source of stability, home, place, belonging, and it's also a place where she's had some pretty serious health impacts. And if she were the mayor, things would be really different about how economic development is going forward. And I think there's the advocacy that Sheena was talking about is so central and really beautiful, because there is an opportunity for change.
And I'll just add another quick thing. The first that I had was related to the instability and cost of housing, particularly for tenants. And for many of the reasons that have already been said about why people want to stay in their communities and the importance of belonging in a community, I thought of two families. One, a family that in Redwood City, in the San Francisco Peninsula, who is dealing with molds, rats, kind of the habitability issues, but can't raise this with the landlord because of risk of eviction, because there are no tenant protections in these places. And so the conditions that people have to endure because there aren't those sorts of protections for them to advocate for themselves. And another family I thought of was a young woman who's dealing with domestic violence, and the cost of housing is prohibitive for her to leave that situation with her young child. And our inability to provide the kind of stability and in addition to all the other health concerns that have been raised on the panel already, and the lower cost housing for people to be able to advocate for themselves and find a path for their families is part of the health concerns around housing.
For my next question, I want to follow up on something that Sheena has already brought up, and that's bringing some sort of historical perspective here. And again, this is to kind of to everybody. What do we know about how the legacy of things like mortgage redlining, racist zoning codes and deed covenants, real estate practices like steering whites and people of color to certain neighborhoods, how do all this sort of history and the buildup of this affect housing and health outcomes for people today? I can call on someone if everybody wants. Well, Jennifer, you look like you've thought.
Well, I was just going to say, is this just a 30-minute panel, Liam? Because
maybe pick one.
The stunned silence, maybe.
Yeah.
Yeah, I mean, this is to get at Jennifer's point. This is a huge question and a huge topic.
Right.
This should be the subject for a whole conference. And I guess I can just point out a couple things. I mean, I think, Liam, you've already mentioned a number of the different tools that were used historically to segregate people to, from the beginning of land use planning, create intentionally communities of color that excluded people of color, immigrants, people who didn't speak English, from white neighborhoods, and to systematically allocate where public resources go and where they don't go. And also where polluting and toxic land uses are located. And so I think there is a huge legacy that we could talk about of redlining, where we have historic maps that demonstrate communities that were denied access to mortgages, which are today that overlaps perfectly with Cal and Virus Green communities that are the most polluted, the most vulnerable, and then the whole series of policies of using deed restrictions in housing to prohibit people of color from being able to purchase into neighborhoods. Some of those still exist. You can see them on assessors' records. And a lot of the communities we work in, they're disadvantaged, unincorporated community in county areas. And those are areas where people of color did have an opportunity to live. They were, not allowed to live in many cities. And so they were able to buy into these communities. But the communities never had access to basic amenities and services. And to this day, they still don't. Communities like Katie's. And one really interesting and sad example is like the Tulare County General Plan. I believe it was the mid-1970 general plan that identified one community, or it identified disadvantaged unincorporated communities and said, identified a policy to systematically withhold infrastructure and services from those communities with the idea that they would eventually just die out and they would no longer exist. But those communities still exist today, and many people still are on septic tanks, which our organization has partnered with research institutions to do soil testing and have found a lot of hazardous bacteria, E. coli, both in the soil as well as in people's tap, because people are interacting with the soil that has contaminants leaching into it. So there is a whole long legacy from these discriminatory practices that continue up until the current time, and has very immediate direct health impacts. And I guess the other thing I want to note that like often isn't as kind of central in the conversations is both the unequal enforcement of the zoning laws that do exist. So I think, those of us who have the opportunity to live in, higher income or moderate income neighborhoods, often neighborhoods that are whiter in composition, we are implicitly relying on the enforcement of zoning laws to keep those neighborhoods looking the way they do. And most of us have never read a zoning code or know what's in a zoning code, or would want to know what's in one, but we're relying on it. Whereas in many disadvantaged communities and communities of color, they're in Fresno, there's a meat rendering plant that has never gotten a conditional use permit that's required by the code. It's never gone through CEQA. It's never gone through environmental review. It's never had mitigation measures. And that is tied to a very long history of the fact that that community is a historical African-American community and a Latino community. And that rendering plant never would have existed in North Fresno, which is much whiter, and it never would have gotten away with not having a permit. So those are, a number of the things that are impacting people today and creating health and housing impacts. But yeah, sure, there's many, many books written about this subject.
I mean, just to add on to it, just like a really obvious point, because this is really right. This could be a 6 hours and we wouldn't even scratch the surface. But it's really interesting when you look at, for instance, predictors of homelessness. And, the general public goes to like mental health and substance use, but actually like one of the strongest predictors of homelessness is that your census tract and whether you're in a high area deprivation index census tract. And of course, that is just sort of a modern word for the formerly redlined areas. And because those communities were so systematically robbed really of resources and of intergenerational wealth, they were, subject to so much over policing and all of these things, and they remain intact in the segregation that they are, that it's an incredibly powerful predictor of who then winds up on the street. Like if I had one question to ask to figure out if someone's going to be homeless in the next year, it would be, have you been homeless before? And if I had two, it would be what's your address, or what was the last address, what address do you currently live in? And if that tracks to a high ADI index, that's a really powerful risk factor. And I think that as a risk factor, it really just speaks to the ways that these communities and the individuals in them have been sort of systematically excluded from resources and protections and all of the things that we're talking about. Likewise, if you want to superimpose, like you name the health condition, diabetes, strokes, COVID, like it doesn't matter. You name premature birth, preterm birth, you name the health condition, and you can track, on a map to these historically excluded neighborhoods.
Yeah, I'll just bring up two things that came to mind as well. I think sometimes in these, historically redlined communities that are now being gentrified, there's both the layer of, disinvestment for the legacy population and then investment for newcomers. And so I'm thinking of examples from Richmond, where we have the Chevron refinery, the largest stationary polluter in the state. And for the people that have lived there and kind of borne the impacts of that pollution, the only public hospital in the city closed a few years ago. And so even though, the refinery can have a fire and explosion and send 10,000 people to seek medical services, there's no longer a public hospital. On the other side, they're building a new ferry terminal, and housing prices are going up, and there are different kinds of developments that attract people to the city that has the end of the BART line and is still transit connected to San Francisco. So there's kind of different layers of kind of invitation for those with higher incomes, and that kind of continued disinvestment. The other thing that I was thinking about is just the way that climate change will change. Where are the desirable and safe places to live? And that can lead to another kind of wave of who gets to live where. And as an organization that works in state policy and is trying to influence climate policy in particular, we can see that without that lens in terms of climate policy that is trying to address root causes versus just look at greenhouse gas emissions. Like, we're not going to get to just policy that factors in people's need for for housing and health and clean energy without kind of the voices of the folks that have been impacted and then will be impacted by climate.
Just, I think, to follow up on that, that leads nicely with the next question I wanted to ask, which is that, well documented that some of these same zoning rules that have concentrated communities of color near unhealthy polluting industries, oil refineries, and away from healthier land uses like parks and open space. Again, to kind of follow up on what you just said, Sheena, how does everybody think climate change may further exacerbate some of these inequities? Or perhaps maybe even a better way to put it is, are we already seeing ways in which climate change concerns or issues are exacerbating some of these inequities? I remember when I was for instance, working out of our LA Times Sacramento bureau, a lot of debate over subsidies for who was going to be able to purchase electric vehicles, and how that was predominantly or disproportionately going to wealthier areas of the state. So one example that comes to mind.
Yeah, my guess is that our silence again is because of the broad,
Yeah, sure.
Be another panel. Yeah. I guess I'll just give 2 quick examples of just things that are popping to the top of mind. We work with a lot of agricultural employees. They are among the most impoverished population in California, have the most severe housing needs, really high rates of homelessness, as like people living in tents, as well as very inadequate mobile homes that are dilapidated and overcrowded housing situations. And so agricultural workers are outside all day. They're feeling the effects of higher temperatures, of smoke from the wildfires that we're seeing happen across the state. And then when they go home, they're subject to dilapidated housing conditions. Among them, many people we work with don't have functioning air conditioning units, and that is not an explicit requirement under state habitability law. So it's not illegal, but I mean, can you imagine working outside in the fields all day? In Central Valley, it gets to be 110 degrees. In the East Coachella Valley, where we also work, it gets up to 120 degrees. And then going home and not even be able to cool down in the evening. So that is really huge. And then like another related impact that we see is flooding issues that a lot of the communities we work in, especially unincorporated communities, but also neighborhoods within cities, don't have basic, they have roads that are unpaved. One road in the neighborhood we work in really looks almost like an ocean wave. It's kind of undulating, and there's no gutters, sidewalks, or stormwater drainage. And so when we have these more intense rains happen, all of a sudden streets just flood, and making it in some neighborhoods just impassable with cars. And then when you have kids that are like trying to walk to school, people that are relying on public transit, they're really, their housing is at risk, but then they're also really impacted in their ability to get around and get around safely and in a healthy way. And so there's different laws on the books requiring local governments to do planning to start to look at these issues, but general plan law often gives a lot of flexibility to local governments to go about how they go about that. And so really advocates do tons of work to try to ensure that that is done in a meaningful way. But right now there is a lot of it is really up to local governments to really recognize the importance and dedicate the staffing and resources to even going after available state funding to address these really significant climate impacts that are building upon historical discrimination impacts.
And I mean, and just 100%, and just to build on that, like, it's not surprising that historically excluded communities in some ways have the least ability to buffer against these negative effects of climate change. At the most extreme, thinking about what's been happening in the falls now or the summer with our extended fire season, and as horrendous as homelessness is, then you add in homelessness when you can't, all the alerts for go inside, close close your windows, put on your air conditioning, and we have these enormous communities living outside with really no place to escape from that. And and that just sort of goes on and on. The severe weather is just most challenging for people whose utility bills are really high or who don't have insulation. And then, when you go more and more extreme, all the way to the extreme example of homelessness. So it's perhaps not a surprise that excluded communities, even though they may contribute less to climate change, they bear the brunt of it. And then maybe just to flip it a little bit, Liam, I mean, in some ways our underinvestment in equitable housing and in support for housing has left many low-wage workers with these incredible commutes, like hours and hours of commutes, which of course is a terrible thing, not only for them and their health, but it's not great for the climate to have people needing to, commute 3 hours to their work. So there's this like bi-directional relationship between our failure in housing policies and climate change.
Yeah, I'll just add that we have some good tools at the state level. Ashley mentioned Cal EnviroScreen, which kind of layers different social and like physical infrastructure kind of determinants of health. There's tools like the Healthy Places Index, which the public health sector uses more, but we don't yet have a tool that really examines the climate impacts that we will be facing, and kind of looking at that predictive model, because we do know that climate threats will be, they have kind of cascading effects in terms of, there's an industrial site and then there's sea level rise, and then that can cause an kind of way, plus extreme heat, it can unleash a lot more threats than are currently there. So it's just one plug that some advocates are working on trying to actually have that tool developed so we can start, mapping them, that we can start directing resources for climate mitigation and adaptation. And one other thing I'll lift up was through this community process that we did with some of our leaders at APEN to actually go beyond just kind of building advocacy skills, but actually come up with idea and policy solutions from the ground up that they would want to see. And through a year-long process of that kind of like community ground truthing, came up with an idea called Healthy Homes. And so that was looking at, the state has some programs to help renters, to help working class folks in terms of energy efficiency and weatherization, which can have a big impact on bill savings, can have a big impact on health, especially when the outside is really polluted or there's wildfire smoke. But also knowing that there are a lot of conditions in the home in terms of dilapidated housing, like not well-maintained housing. And there's also programs for public health to deal with mold, lead, pests. And so why aren't we pairing the two and adding renter protections so that people can have, habitable, healthy homes without being worried about getting displaced after, a property owner gets money from the state to retrofit and rehab the housing. And so one lesson from trying to move that bill through the state process was that our actual structures in governance were not equipped to deal with such an intersectional bill that dealt with housing, energy, and health at the same time. And even though a lot of decision makers and elected officials thought it was a good idea, there was a lot of confusion about like actually how to get this bill through the process intact. And so I think that was another lesson for us, that our actual structures have to change to be able to be more intersectional in the future.
And how would you go about, this gets a little more to the solutions thing I want to talk a little bit about. How do you think the structures can and should change both at a micro and macro level to address some of these issues that we're talking about? And we can go back to you, Trina, but then it'd be great if everyone else can add their perspective as well.
Yeah, we definitely think that that idea was so strong because it came from our community base and that lived experience of what was happening. And that same year, we were pushing for another bill, which was around community engagement and cultural competency in emergency planning. And I lift that up as an example of trying to insert requirements for those doing, in that case, emergency planning, to actually hold accessible community forums and take impact from the community into the emergency plans. And knowing that if that, with trusted messengers, because right now a lot of the county emergency plans are held in the sheriff's office, which we found, even if they were to do some community outreach, probably not the most accessible or welcoming entity to do that. And so shifts like that in terms of what public agencies and departments can have the trust of community, and what are ways to actually get people to weigh in on the plans, what are ways to create avenues for feedback and discussion and accountability that will make the plans more effective and can continue to advance and adapt.
Jennifer, I'm wondering, when you're advocating for tenant issues and tenant protections, how useful is it, or how effective has it been, or do policymakers maybe understand, is maybe a better way to put it, when you bring up sort of related concerns about, say, environmental justice, climate change, health equity, things like that? Or do those issues are they part of the conversation, and how resonant are they when you're having these broader debates?
Yeah, actually, it's been great to be working more closely with public health departments over the past probably decade, as they have started to recognize the social determinants of health as being a frontline way of approaching public health issues, and housing being a central component of that, what Margot was talking about earlier. And what's been helpful about that is that it takes it out of this kind of dualistic debate around profit making and profit, like the profit margin around that is often the central focus of development related or housing related, property related policy making, and turns it into a social good. I mean, this is essentially what we're talking about, is the way we design housing, who gets to live there, how communities are designed, and who gets to have input in that decision-making process of design is essentially a social good. It is, my own neighborhood was on a front page of the New York Times over the summer as one of the spiking neighborhoods because of the overcrowded conditions in a historic neighborhood of color, where, with, spiking conditions of COVID. And so what we're not really thinking about is how all of these design moments, whether it's the general plan or the work that Sheena was talking about, housing element processes, they're completely inaccessible. I've worked on a number of housing elements, spent thousands of hours trying to get communities involved in them. They're really, they're being designed with the perspective of high wealth homeowner interests in mind. They tend to be short-term in nature as a result, so just thinking about status quo or historical preservation, quote unquote, and not looking at the intersectionality of these long trend issues that really contribute to slow erosion, whether it's the erosion of the climate conditions, erosion of our health conditions, erosion of stability, et cetera. And so, like, our public processes, unfortunately, are not really designed to do all the things that are necessary in order to be fully inclusive and think in long-term ways. And so in some ways, it's incumbent, especially at a moment like this, where we have these incredible intersecting crises. This is the moment for us to reckon with that condition of the failure of our public policy making systems and processes, and to start to think, find opportunities for us to create that longer term view and more inclusive process. That's not a concrete solution, Liam. Like I feel like we're struggling to get our head around, well, how do you do that? And I'd love to, if others have ideas about how to do that, but it seems imperative. We're already 2 decades late. Like we're already dealing with the consequences of decisions made many decades ago. And so we've got to start approaching the problems in that way now.
Yes, hi, my name is Stacy Holly. Can you hear me? I have these headsets on. I just need to know if you can hear me or not.
Yeah,
Is it
yes,
clear?
yes.
Okay.
I-
So I'm a little perplexed because I remember like maybe a couple of years ago where um Governor Newsom had signed a bill for like homelessness, and basically it was to sign a bill for like the local. I work for a local. I work for the state, but for the local governments to use these tools to confront the crisis that's going on today in terms of homelessness. And what really kind of bothered me is this morning I just happened to take my daughter to work. She works in Berkeley. And so I was over near the Berkeley Marina, and to see it was like a whole community of homelessness. And my thing is, and I know I'm probably not saying this right, but why is it taking so long for this to happen? I mean, it was really sad to kind of just see. I mean, Berkeley back in the day was
Right.
a really nice place to go. I mean, to hang out and, and eat dinner and so forth. But now it's like you don't even want to go over there because, I mean, it looks, I don't know if you guys saw this movie, but it looks like a District 9 to me. It's just all over the place. And then
Sure.
as you go over the hump, then you have these $1 million complexes that they threw up not too far from it. And I just
Right,
didn't
right.
understand that.
So yes, and we're going to get in, and we're about to just get to so sort of some audience questions and those that address homelessness, and I think we'll wrap that in. So just give me a second to ask sort of one more a question, and we'll get to audience questions shortly, which I'm sure will address homeless. I do want to ask, and this sort of is somewhat related before we move on, and this is. Related to now during the pandemic, by one study that's come out already, there's workers in 1 million renter households across the state have lost their jobs, and there's been this sort of very broad patchwork of eviction protections and rent relief programs coming out of local governments, coming out of the states, and coming out of the federal government. And I want to ask, our panelists, how well that they're working, and maybe Ashley, I want to start with you. I know Fresno has been really hard hit in sort of all these areas. A lot of the bigger metros around the state have seen rent declines, but in Fresno, some of the highest rent increases during the pandemic of any place in the country. And so maybe Ashley, you could address that, and if there is something about homelessness you want to add to that point, that would be great as well.
Thanks. Can you hear me now? It wasn't letting
Yeah.
me unmute. Hi. Yeah, so there was a Fresno Bee article that came out just yesterday, identifying Fresno as the place in the country where the rents are rising the second fastest. So the rents over the last year have gone up 10.8%, and over the last 4 years, it's been 34.5% about. So that's an incredible jump, and it's in a place that is, has some of the highest poverty rates in the country. I think before the pandemic started, there was already California Housing Partnership, I think, had identified that there was like a need for 35,000 affordable units. So obviously coming into the pandemic, there was incredible housing need across California, including in inland California. Really high percentages of people severely rent burdened, paying more than 50% of their income towards rent. I think what we find is that a lot of people would rather go hungry than get behind on their rent payments, because housing is it is so critical, and people don't want their families to end up on the street, their children, and so people are cutting back on meals. They're getting behind on other bills. They're asking for relatives to provide assistance, and so we have done a lot of advocacy relating to trying to seek both state and local level protections, and are finding it really, really challenging. I mean, first, as you mentioned, there's this very complex patchwork of local, state, and federal laws. I think we're finding that local governments are many local decision makers don't really understand how they interact or what the protections are, let alone tenants and landlords. And so recently SB 91 was passed, which extends protections that were passed last year, limiting, pushing out tenants' ability to be evicted for non-payment of rent. And we're finding that landlords aren't aware that it passed, or maybe they are, but they're still trying to secure rent payments from tenants who aren't able to pay, and then aren't providing notices that are legally required. So a lot of tenants don't necessarily know their rights, and then they don't have access to legal counsel. So in the regions that we work in, there's a huge lack of pro bono and low bono legal assistance. And this is especially true for undocumented residents. In inland California, many and in some places, all of the free legal services that are available are from federally funded legal service corporation legal aid organizations who are prohibited from serving undocumented residents. So many people just have nowhere to turn, and they are being pressured by landlords to make payments, which they might not necessarily be required to make. So it is really a severe issue right now. I think advocates and engaged residents across the state are really, really pushing to get more accessible information to tenants and more resources available to people. But it is a crisis that, at all levels of government, we need to be putting all of our attention to.
So I want to jump back to what our audience member had discussed, and please, if you do have questions, if you could put them in the chat box, that'd be great. But directing this at Margot, given your expertise, so there has been a lot of attention, obviously, paid by local officials again, and the state, on homelessness issues, a number of bills, too many to count, bond issues at the state level and regional, local level. But at the same time, we continue to see sort of rising homelessness numbers around the state. Is it sort of, on the one hand, is it too soon to assess, or how can we assess what's been done already prior to the pandemic? And how has the pandemic, further exacerbated some of these homelessness concerns that we're seeing?
I mean, there's no question that there's been a lot of particularly local activity, around homelessness in LA, Measure H and HH, in San Francisco, Prop C. There's been some statewide work on various different ways. I think that the problem is that the scope of the problem is so enormous. And I think I worry that it creates this narrative of like, well, why even try? Because they've done things and it hasn't worked. But we're really doing things at the completely wrong scale. I mean, as many on this call know, like in California right now, we have about 150,000 people pre-pandemic who are experiencing homelessness every night. We're about 1 million units short on what we call extremely low income housing, or housing that's affordable to people who make less than 30% of the area median income. We're the second worst state in the nation, where we have approximately 23 units affordable and available for every 100 ELI or extremely low income household. And, things like the federal voucher program, only serves 1 in 4 households who meet the criteria. I mean, we are just so far in so many ways beyond. We haven't been investing in on the federal level and in giving the subsidies that are actually needed to produce this housing or to protect the housing or to preserve the housing that exists. And then as we've been talking about a lot, the local zoning laws are just sort of a hot mess. So I worry that the wrong lesson could be taken of gosh, the governor did something, or San Francisco did something, or LA did something, and it didn't work. Because what you can't see is what we would call the counterfactual, what would have happened if those things hadn't passed. And the truth of the matter is it would have been a lot worse. But, I think LA is a good case where they invested a ton of money, 2 big measures, lots, much money. And yet for every person who they lifted out of homelessness, 1.7 people fell into it. So it's sort of like bailing a leaky boat. Now, of course, if they hadn't lifted that person out of homelessness, many more would have come to it. But we're never gonna solve homelessness by just taking the people who are homeless and getting them into housing. We've got to actually get to the root causes. I think, the pandemic is terrifying. I mean, I guess, the bright spot is that there's more attention to it, and there has been a fair amount of federal interest in it, as well as state action as well. I think we've seen, even with all these eviction laws in place, there's just a lot of leaking around it. KQED just did a really good story on the number of evictions just in the city of Oakland, because really the eviction protections were very much narrowly focused around COVID. I think the other thing is, not only do people not have access to legal counsel, so they don't know about their rights, but so many people are living in these doubled and tripled up in sort of informal arrangements where they don't hold a lease, and their tenancy rights, they may not really have tenancy rights, or it's harder to interpret. So, my fear is that this recession, or worse than a recession, has been so split, right? That wealthy people have actually done really well and the poor people have done really poorly. And there's been so much pent up housing demand that we could have the worst case scenario where a lot of folks are evicted, and yet prices don't really depress because there's still pent up demand for them. And that would really be the worst possible thing. I think we don't want to redo what we did in 2008, which is when there was, we let the foreclosure crisis happen, and then a lot of those properties basically got held by speculators and not returned to the community. And so I think this is a sort of a frightening time where we could go really wrong, but there's some promise, and that there's some energy around it. There's more awareness around it, but I don't think anything we've done so far would I expect it to end homelessness. We're just not working at the scale that we need to work at.
Jennifer, could you add some things on what you're seeing on both the eviction protections and how well or not they're working in rent relief programs, and also how these things may be contributing to further exacerbation of homelessness issues during the pandemic?
Sure. One of the challenges, I mean, what Margot said is absolutely all right. The scale, the complexity of the issue isn't really being dealt with. But in terms of the narrow focus on the tenant protections, I think one of the challenges we're finding is that a lot of local jurisdictions don't have established infrastructure to support the now many hundreds of thousands, if not millions, of tenants that are going to be needing to seek resources, and their landlords, quite frankly, because there are many landlords who are doing a good job creating homes for people, and are now also at risk of losing that to potentially speculators or large corporate interests that would be buying those properties up and using them in different ways. So I think we just don't have the basic infrastructure. And I was on a call yesterday to talk about the details of this SB 91 and to learn about the implementation, and honestly, I have to say, to be part of that conversation almost brought tears to my eyes. The nuance that is required in order to truly address the most vulnerable, those folks who don't have formal leases, those folks who are speaking in other languages, that living in places that don't have nonprofit resources or local government infrastructure to make sure that they're getting the information and access to relief that they need. These are massive problems that are happening very, very quickly, and we need all of us to be leaning into creating the solutions around them. As Margaret was saying, the knock-on effect of not preventing a person from becoming homelessness can then be multiplying the issues we have in terms of health, in terms of work, in terms of education. And so, you know, for us to be really focusing on keeping people in their homes in a time like this and building their necessary infrastructure to do so over the longer term, because this isn't going to end in June or whenever the expiration of eviction protections is going to happen. This is going to carry on. This is going to be a multi-year problem, and so I you know, I think one of the major issues here is we don't have the scale of resources and the infrastructure to deploy the access to relief that people need immediately. Yeah, I wish I was a little more hopeful. I'm still kind of trying to soothe myself from that call yesterday of the distress that I was experiencing. But you know, I'm hopeful that we're all on this call and that there's, you know, hundreds of thousands of us ready to lean in and try to figure this out.
Yeah, and it's not only
writing about Carolina.
Yeah. Yes. Yeah.
Hey, Liam, can you hear me? This is Carolina from CPEN, and just wanted to point to one of the questions in the chat box. Nancy here asked a really interesting question. First, she said that this is really great and also very painful conversation and has raised a lot of really critical issues. And Nancy was wondering if any of the panelists could speak to the overlay of hunger and lack of access to safe food as well.
You know, I think there is such an overlay in so many of the ways between hunger, food insecurity, and homelessness. I mean, first of all, there's this competing need, right? Like, do you pay your rent first? Do you pay your food first? People tend to feed their kids first and then like pay their rent and then feed them. So, you know, and so there's that of just that these incredible cost pressures. But then a lot of the conversations that we were having about historically excluded areas, you know, are often areas that don't have access to healthy foods, and that, you know, what they have access to are less, you know, calorically dense but nutritionally poor food. So I think it's hard to in some ways separate those conversations about housing pressures and food pressures, because the same areas of sort of areas being excluded or deprivation lines run the same way in terms of fresh fruits and vegetables and grocery stores and all of that, but also the very real cost pressures of, like, you know, what do you pay first? Do you pay your rent first so you don't fall too low behind, or your food bill first? And so they're pretty tied together, and they're probably all on the same, you know, they're all influenced by structural racism, and then they're all on the same pathway to poor health outcomes.
I think we probably have time for just one last thing, and I think this is a good question to end on, from an audience member, Flora Zambakari. Her question is, what can people do to help with this issue if they do not work in this sector?
Well, I would say, I mean, this applies to this issue and, you know, probably every issue that's covered in this conference, but, you know, look out for what local advocacy organizations are doing in where you live, and especially organizations that work directly on the ground with impacted people and communities of color, and connect with them, learn about the issues, and look for opportunities to talk to your elected officials, city council members, state officials, because there is a lot of like inertia, there's a lot of forces to keep the status quo as it is, and for these problems to continue to exacerbate, especially with the pandemic. And so it really takes huge momentum pushing the opposite way to create the deep policy changes and changes in investment that we need. So we really need elected elected officials to be hearing from many, many people about these issues and the need for change.
All right, so I think we're out of time.
I would also
thank you very much.
just to add really quickly, like,
Yes.
I don't know
Yeah,
if any issue
yeah.
doesn't touch on these that we've just raised. I mean, you know, we didn't get into the issue of policing, but like criminal justice and policing issues have to do with these, you know, there's so many intersection and you know, our bureaucratic systems don't treat them as intersectional, as Sheena's example raised earlier. But, you know, whatever entry point we're operating from, we should be recognizing these as all intersectional, so that we can get to the place where our bureaucratic and policy systems can treat them that way as well.
All right, so appreciate good discussion from all of our panelists, and thank you so much for audience members who've been engaged and asked some great questions. And I appreciate everybody's time, and I look forward to hearing everybody's reactions on the panel and further events throughout the day. So thanks very much for attending.